I've not requested time to speak to you before, but believe it's important for you to understand from a clinician's point of view where we stand as a healthcare system, that there is a breaking point and that we are at it. We all grow numb to the numbers, how many cases, how many deaths, how many ICU admissions, but to those of us on the front line, the patients and the deaths are real, and the toll on healthcare workers is personal. It's been a bad couple of weeks at EIRMC. We've seen over 20 intubated COVID patients on many days, and so many on the wards that we've had to open space in radiology to house the less sick patients with no room on the usual wards. But the toll is also personal for staff. We've buoyed each other, we've helped each other with that extra patient. The ICU nurse knows he or she can't take care of in a usual manner, or the ward nurse with more patients than can be adequately monitored. Make no mistake, we're already rationing care. Under normal circumstances, some patients who would be triaged to a higher level of care are unable to be admitted to the ICU. So we admit them to the COVID ward, and they're worrisome for decline, but because the patient in the next bed in the ER seems more likely to decline and need intubation, we make choices we normally wouldn't make. Let me describe my day in the ICU for you, if I could. We start by getting a list from the respiratory therapist of who on the wards is on high flow oxygen, the most support we can provide short of intubation. We take the list and we go see each of those patients on the ward and try to get a sense of who's likely to crash and to be able to transport them to the ICU before they need emergent intubation on the ward. But it's a judgment. There aren't enough ICU beds for everyone who's worrisome. And so we try to estimate who's most likely to crash, and we get it wrong sometimes. We have no further capacity. It's not the stuff, the ventilators or the dialysis machines, for instance. It's mostly personnel. How much can you stretch that most valuable resource of the trained nurse and respiratory therapist and the physician and all the ancillary staff that keep things running? For instance, a housekeeper who rushes to clean a room when someone dies or is moved, understanding the next patient in line desperately needs to get from the ER or the ward to that room. And I never forget that housekeepers are the highest risk of healthcare worker-acquired COVID of any of us. So many of them are in vulnerable category for severe COVID. We thank them, we remind them they're an important part of the team, but as for all the staff, the look of worry and apprehension for themselves and their family is never far from the surface. EIRMC is the final common denominator for the region. If we can't accommodate the patient who's exceeded the capability of the smaller hospital, that smaller facility must somehow take care of them beyond their ability. So we work very hard at not being in that position. Let the ICU nurse take one extra patient, the rest of the staff will pitch in. Or let the charge nurse take care of a patient when he or she is supposed to be the oversight and the extra set of eyes and ears for the entire staff and can't be that monitor if saddled with direct patient care. Or accept the patient and maybe, just maybe, they won't actually need the ICU bed we don't have. Knowing if they go to the floor, that ward is already beyond capacity. But still, we sometimes can't accommodate just one more. And over the weekend, for a brief period, we went on stabilize and ship, meaning no acceptance of outside hospitals patients. And the patients who present directly have to receive emergent stabilization and then be shipped out rather than admitted. All the while knowing there isn't really room anywhere to ship that patient. Fortunately, it never came to that, mostly because we make do rather than put a patient in harm's way. Please realize beyond a doubt, we are already rationing care. This is not our usual standard of care. We all pride ourselves on delivering as good a level of care as any regional hospital in the Northwest. We have to. We are the referral center, the final common denominator for the entire region, and we've always prided ourselves on the knowledge that any patient here will get a state-of-the-art care as in any regional medical center in the Northwest, including any university center. but we're unable to provide that level of care now. We are in a crisis none of us have ever seen, doing our damnedest to provide the most good for the most people. I'm witnessing the most courageous, selfless, tireless behavior by our staff in the face of always recognizing the personal danger this pandemic poses. But there is a limit. The administrative team is doing everything they can to acquire more staff, travelers, enticing part-timers to full-time, increasing pay shift differential, which isn't much incentive if you're already exhausted. But we're competing with everyone else in the region and in the country. And we're losing staff to other hospitals who offer experienced ICU nurses more for a week's work than they are usually paid for 2 months. But mostly we endure, supporting each other, crying for each other and the patients who die alone without family, often several a day. And the staff do what they can to comfort the patients and family, talking with relatives, FaceTiming on iPads, so at least the loved ones can see their sick relative. And the patients are more time consuming, much more complex than usual ICU or ward patients, more drips to change, more ventilator adjustments, more time turning patients, most of whom must be prone to time consuming, high risk procedure in which we place the patients on their belly. But we've endured. And now I'm asking you that it's past time for you to take definitive action. You must stop listening to the lunatic, delusional fringe out there who thus far inhibited you from fulfilling the most legal and moral authority you have to do anything within your power to decrease the destruction, the illness, and the death. I believe you can no longer pay attention to a small faction of the population who either cannot or will not see the consequences of their reckless, life-endangering behavior. There's no more basic responsibility of government than protection of public safety. And as a health board, as you know, you clearly have direct responsibility for protection of that public safety, and you clearly have the authority. You would not allow a person with tuberculosis to ignore quarantine requirements. You have a legal authority to detain that person. Yet we're allowing individuals to have effective measures that would quell this awful increasing growth in COVID cases with a disease more deadly than tuberculosis. This is completely illogical and maddening. We have as a society chosen to allow bars to stay open while closing schools. We've allowed business employees to risk infection because we refuse to prohibit customers who ignore the mask mandate. And we endanger customers by employees not masking. We've allowed spread to go unchecked to the point where we're on the verge of instituting crisis standards of care as a state. And that will overtly decide who gets care and who doesn't, who dies and who gets a chance. And for what? To appease a small minority of the population who either cannot or will not understand their endangerment of the larger community, and who will not be convinced to voluntarily adhere to life-saving cautionary measures, no matter how much you attempt to persuade them with recommendations that have no teeth and no enforcement. I'm asking you to act now, immediately, today. You have the legal authority and the responsibility to enact measures that will enhance public safety, such as including an enforced mask mandate, a clear limitation on gatherings, enclosure of non-essential businesses such as bars and restaurants. You have the authority and the responsibility. I mean no disrespect. You've acted honorably and honestly. I've been appreciative of this board, and while disappointed at the lack of rigor, have supported you. But the time for compromise, the time for appeasement, I believe has passed. You can direct law enforcement to enforce your directives. You have both the power and the responsibility. Law enforcement agencies don't get to decide what laws are passed or what laws are enforced. To do so would be an existential threat to our democracy. You must act. To do less would be an abrogation of your responsibility and a denial of what you were elected to do. I have a great deal of respect for you as a board. I would ask you to consider where we're at as a community and that we need to act now. Thank you. I'd be happy to answer any questions.